Tonight, we honor the heart of healthcare during the 10th Annual Excellence in Nursing Awards. Over the past decade, we've recognized more than 500 outstanding nurses across the region. We couldn't do it without the help of a distinguished selection committee comprised this year of respected leaders from such organizations as Johns Hopkins University, the Mayo Clinic, the University of Missouri Kansas City, and the Get Well Network. In all, they scored a record 300+ nominations and selected 60 finalists across 18 categories. These nurses represent a wide range of practice areas and levels of expertise, from emerging leaders to those with decades of experience. We never cease to be inspired by your stories. Somehow you make the life-changing look routine, and you do it all with a sense of commitment, compassion, and grace. For that, we say thank you.
Rebecca is a role model for our nurse practitioners and our nurses. She serves as a primary preceptor for the majority of student nurse practitioners and new nurse practitioners to really help them to learn the role in a very kind and patient way.
All I've ever done is neonatal intensive care nursing, so this is always where my heart has been. However, as I had gone through the staff nurse training, I wanted to know more about why we did the things we do to our babies, that pathophysiology, that in-depth knowledge of treating them, and so that's what really inspired me to go to nurse practitioner schools. I wanted to know why we were doing the things we were doing, and that way I could also give the best care possible and help be a leader on the team, not just working at the bedside all the time, but actually making plans and working with families more closely.
I think the difference for Rebecca on our team is her level of compassion for the field of neonatology and for nursing. She really enjoys what she does. She's passionate about her work. She steps outside to do research. She's written journal articles. She's done a lot of work in the field.
When I first started my career, I was in the hospital in medical surgical. I did ICU, regular floor, and I also did neonatal ICU, community health, public health. And then, of course, probably most of my career I've been a nurse practitioner in primary care. I realized early on that the future for nursing education and to really push the profession, we really needed to have doctoral education and research. So I went and got my PhD and became an associate dean. When you look at what a nurse knows, what they're able to do, there's all kinds of things when we use their expertise to their fullest potential to really make a difference in a patient's life and, frankly, to make a doctor's life easier too.
Dr. Ridenour is just a stellar individual. And she's somebody that you want to emulate. You want to grow up, as it were, and be just like her, because she has really made a significant difference, not just in my life and career professionally, but I believe she's had a huge impact on our school overall.
Because I'm a nurse, I've been able to work all over the world, to have very wonderful experiences. So I would recommend it to everybody.
Mary Ellen, she is the biggest patient advocate I've ever met in my career. She has spent countless hours, both here at MOBAP as well as in her career, helping individuals maintain their livelihood and financial stability that sometimes doesn't come along with the diagnosis of cancer.
I went into nursing straight from high school. I really had no idea at the age of 18 what that would look like, and had no clue that I would be so incredibly passionate about it for the rest of my life. I think as you evolve into different roles in your nursing career, you also need to grow and find what drives your passion. For me, I help patients navigate through some of the financial issues that they have with regard to the cost of healthcare today. So I find my rewards in resolving those issues for patients and relieving the stress that they have related to financial cost of care.
Mary Ellen is truly a servant of both the patients and nurses here at Missouri Baptist. And it's through that servitude that we have been able to have the quality outcomes and treat thousands of lives here for our greater St. Louis region.
I'm an orthopedic nurse coordinator, and I do the education piece for the patients preoperatively in clinic and kind of coach them through the perioperative period. I do a lot of phone call, question and answer. I check on them through the recovery and then coordinate their post-op visits.
So for Simone, it really goes beyond just educating the patients. I joke around with her all the time that I just do the surgery and she takes care of them, but in a way that actually is true. She's really their point of contact before surgery, during the surgical process, afterwards. She meets them in the clinic and she really holds their hand through the whole process. She takes care of all their needs. On a day-to-day basis, she goes way above and beyond anything I would expect her to do. And routinely, just about every single patient, when I see them back in the office, thanks me and then tells me that they want to thank her for all of her hard work and how much they appreciate her. I've always been impressed by her energy. She has a certain glow about her that I think colleagues, people younger than her in nursing, as well as patients, are really drawn to and take to. Her approachability, her friendliness, her kindness, the brightness that she has, really puts patients at ease, and they feel like they're buddies, when they come back for surgery and she sees them in pre-op. They get excited to see me and they shake my hand, but they usually give her a hug and are, laughing together by the end of the little encounter.
Well, nursing to me is my second profession. I actually went to school for computer programming and I couldn't find a job. And I found myself trying to live vicariously through others, suggesting that they go to nursing school. And then one day I finally said, Krista, you want to be a nurse. Why don't you go for it? I applied for nursing school, got in, and now I'm here.
Implementing a holistic admissions process, she's really the driving force for implementing a process like this in the traditional option program here at SLU. This is a huge undertaking because we have a really large enrollment as well as a huge incoming class. But this is something that Krista is really passionate about, so when she's passionate about, she goes for it. And she has basically single-handedly gone through so many applications to look past the grades and the GPAs in order to see the student for the whole person and give students opportunities they might not have, but also to enrich the student experience for all of our students here at SLU.
Now I have the best of both worlds. I get to take care of people, I get to help support them in one of their most difficult times, and I get to educate the future on how to do so as well. I find pride and a sense of ownership in helping our future nurses, knowing that I'm able to make an impact on how they practice nursing and how they are compassionate and empathetic with their patients they serve.
So I work in 56 ICU, it's a cardiothoracic intensive care unit. We care for heart and lung transplant patients, both pre-workup and post-transplant, heart bypass, valve replacements, any aortic thoracic dissections. Our patient length of stay can anywhere be from days to months. We had one patient that was with us for 15 or 16 months. Over time, you develop this rapport with these family members because you're taking care of someone for 13 hours a day for months at a time.
We can treat the patients with all of our clinical knowledge, but it's all the psychological stress and social stress that it takes to care for that family. And she takes that upon herself to take those family members under her wing, explain what's going on in great detail, and support them through both the sorrow and the stress that they're feeling as a family.
Well, I like to make people laugh. It's a stressful environment. It's never easy being here. We see, life and death every day, and you have to make the best of it.
Amber loves to make people laugh. I think that's her goal, is to make people laugh. And downstairs can be so depressing sometimes because our patients are so sick, and she'll always just see the bright side of things, and that's her job always, is to make people laugh, and she does a great job of that. She's really a person that I admire for her personal life and her professional life. She's just an admirable person.
Angie goes beyond the call of duty virtually every day. You know, when she is dealing with patients, she frequently brings us all together, doctors, patient families, and of course the patients, in order to communicate better. She knows the issues, she listens to what they want to know, and she communicates that to us so we can address it when we deal with the patients and their families.
One of my favorite questions I ask my patients, you know, they're in their 80s, is what was the name of the first person you ever kissed? And sometimes it will take them 6 hours to come up with it. And I'll walk into the room and they'll say, Betty Sue, you know, but that has occupied their time a little bit. Instead of thinking about what's wrong with them, how sick they are, what's gonna happen in the future. Just to have conversations about everyday normal life, in addition to how their health is doing and what the plan of care is. If you encapsulate all of that together, that'll make you a well-rounded nurse.
Jordan is special at his job because he really connects with patients and families. He is a wonderful leader here in our unit. He's a frontline staff nurse, but he works in a specialty role where he helps prepare our families for discharge. And that transition from hospital to home can be really terrifying for some of our patients and families. And so having Jordan on our team to help really smooth that process and make sure that families feel prepared to take their child home is really important.
I started really hands-on. I was really ICU centered when I started. I was like the adrenaline junkie, kind of like really involved in wanting to do the procedures and everything like that. And I started doing this discharge piece and got more involved with that, and it was just kind of like a gentle change, and then all of a sudden I'm looking up and I'm caring more about doing this teaching perspective, kind of focusing more on teaching with the families.
He has really great teaching skills. He's all hands-on, so when there's a task that a family needs to learn, he is able to be there and be at the bedside and really doing that demonstration and then ensuring that the family understands how to do that skill so that they feel confident taking their child home. And then at the same time, he can share his knowledge and skills with the rest of our team. So obviously he's not here 24 hours a day, 7 days a week, so we really rely on him to teach the rest of our frontline staff some of those same skills to be able to teach families what they need to know.
Best part of my job is the beginning to the end story that you get to see.
I think Jordan is deserving of this award because he is constantly going above and beyond for our patients and families.